Aspiration of food. We've mentioned vomit, gastric contents, but aspiration of food can cause asphyxia. We normally refer to this as something going down the wrong way, don't we? You know this, sometimes you're eating and you get choking. This happens especially if you try and eat and talk at the same time. So don't try and eat and talk at the same time. But we get this choking response, and if it's a large piece of food is inhaled, it can completely block the airway, and the patient will start choking or start suffocating. They will asphyxiate because the airway is blocked off. So aspiration of food or other gastric contents. And drowning, of course. I mean, water can certainly be considered as a foreign body. If the airways are filling up with water, then clearly the patient will asphyxiate. Sometimes in drowning, though, the vocal cords will go into spasm, which is good if you can get them out because it means the lungs aren't full of water sometimes. Of course, plastic bags are major danger, especially to children. If children put plastic bags over their heads, they can asphyxiate completely because they can't breathe through it. So this is a particular danger with young children. They put a plastic bag over their head, they can't breathe, and children do die from this. So it's very important when looking after young children to consider the environment, because kids put everything in their mouths. It's just the way they feel things. They just be crawling along the carpet, they find something, they put it in their mouth, and then there's the risk of them choking on it. So think about the environment when you've got young children. Is there any plastic bags? Are there any small objects that could potentially cause them to get in the mouth and cause them to choke? So suffocation, plastic bags, other small objects. Other clinical things that we could think of: retained secretions. If the patient is unable to expectorate secretions. If there's depression of cough for whatever reason. Pneumonia can generate a lot of secretions. And in cystic fibrosis, which would really better be called mucoviscidosis, the mucus is viscous and can't be cleared and can obstruct airways. So, causes of asphyxiation. We've looked at trauma. We've looked at foreign bodies. Let's now consider inflammation as another cause of asphyxia. Now, in inflammation, there's edema around the trachea or other parts of the airway. Remember, in inflammation, you get swelling. So there may be edematous pressure on the airway. And this can be a particular problem in allergic reactions to things like bee stings or wasp stings, or indeed to foods like peanuts or shellfish. Or indeed to drugs, especially with antibiotics, there can be allergic reactions. And here you get swelling round about the upper airway, which can be very pronounced. And of course, if this is bad enough, it needs to be treated with intramuscular adrenaline. 0.5 to 1 milligram of intramuscular adrenaline, which is 0.5 to 1 mil of 1 in 1,000 adrenaline intramuscularly for an adult. Of course, a much smaller dose for children. Inflammation may occur secondary to infection. And this is a particular problem again in children. If the epiglottis is inflamed in children, it can completely obstruct the airway because the rest of the airway hasn't grown yet. So epiglottitis, potentially very serious in children, and they must be monitored all the time to make sure that the epiglottis does not block the airway, leading to asphyxia. Inflammation can be caused, we've already mentioned thermal injuries actually, but it can also occur with caustic injuries. For example, if there's any nasty chemicals that have been in the mouth. Very irritating, cause a lot of inflammation, swelling, inflammatory swelling, and potentially asphyxia by blocking the airways. We looked at trauma, we looked at foreign bodies, we looked at inflammation. Let's now go on and look at congenital lesions. You may come across these in clinical practice. things, congenital means simply present at birth. Not that common, so we'll deal with them fairly quickly. Subglottic stenosis, literally narrowing under the tongue. Any of these congenital lesions can be aggravated by superimposed infection. So any time there's a congenital lesion in combination with infection, the children should be monitored to make sure their airways remain patent. And some of these abnormalities can progress as the child gets older. So congenital lesions, particularly those exacerbated by superimposed infection. Developing tumours can block the airway. And of course, malignant tumours are very dangerous in their own right, obviously. But as well as that, benign tumours can be a problem purely because of their physical presence, even though they're not going to metastasise, because they're there in a particular part of the body that's near the airway, they can cause asphyxia. Now, everything might be in order apart from the fact that the patient can't move the respiratory apparatus. And again, this can cause asphyxiation. This can occur after electric shock. Where artificial ventilation may be indicated. And it can occur after venom, some snake venoms. The sorts of snakes called elapids. Can cause paralysis and paralysis of the respiratory muscles. Now what happens with elapid type snakes, basically there's two sorts of snakes, very basically. There's vipers which cause hemorrhage, and there's elapids. And elapids can cause neuromuscular blockade. The message can't get through from the nerve to the muscles, or the respiratory muscles in this case. And this can occur with cobras, king cobras, mambas, and crates, the stripy ones, the black and orange, or different stripy snakes. So paralysis can occur after bites from cobras, king cobras, mambas, and crates. Very dangerous snakes. But the actual cause of death can be paralysis of the respiratory muscles. Very, very distressing condition. Venoms and toxins. And of course the treatment there really is to get some specific antitoxin. Dysfunction of the vocal cords due secondary to neuromuscular disease, or indeed neuromuscular blocking drugs or agents as we've just described. So causes of asphyxia, we've thought about trauma, foreign bodies, inflammation, congenital lesions, neoplasms, paralysis, and now we're thinking about ventilatory failure. In actual fact, there's probably a bit of an overlap with the last category here, but let's look at it separately. After grand mal convulsions, there may be various periods of apnea, the patient not breathing. So apnea may occur after fits. Of course, as this is prolonged, it might be a good idea to help them to start breathing again with some artificial respiration. Drugs can cause ventilatory failure, particularly opiates and alcohol. Now, anything with an opiate molecule in it, like opium, morphine, diamorphine, any of these things, brilliant analgesics, but they can cause respiratory depression. They can directly reduce the activity of the respiratory centre in the medulla oblongata of the brainstem. They can reduce the activity of the respiratory centre. So very important to monitor patients who have been given opiates, and if they do stop breathing or the breathing is inadequate, we need to reverse the opiate by giving them Narcan or naloxone. By an intravenous injection, actually, we'd have to give it. So opiates can cause respiratory depression. Benzodiazepines can cause respiratory depression. And alcohol can to a degree, although I haven't actually seen alcohol causing respiratory depression directly. I've certainly looked at